Good day everyone, my name is Janica May J. Spiritu, and for today I'm going to demonstrate how to administer oral medication along with Optic and Otic medication. So first, perform hand hygiene and observe other appropriate infection prevention procedures. Wash your hands and apply soap. Wash your palms together. Rub the back of each hand with interlaced fingers. Rub your hands together with interlaced fingers. The back of your fingers interlock. Rub your thumbs. Rub the tips of your fingers. It is very important to do hand hygiene because we can prevent and control the spread of many illnesses. And we can be free from microorganisms. Rinse your hands thoroughly and dry it with a hand towel. And turn off the faucet using a tissue. Next is to unlock the dispensing system. Obtain appropriate medication, read the MIR and took the appropriate medication. Compare the label of the medication against the order on the MIR. Check the expiration date of the medication. Return expired medication to pharmacy. Use only medication that had clear, legible labels. Prepare the medication. Calculate medication dosage accurately. Prepare correct amount of medication for required dose without contaminating medication. And last, recheck each prepared drug and container with MIR again. tablets or capsule, place package unit dose, capsules or tablets directly into the medicine cup. If using a stock container, pour the required number into bottle cup and then transfer medication to disposable cup without touching tablet. Keep narcotics and medication that require specific assessments separate from others. Score tablets only if necessary to obtain correct dosage. And in liquid medication, thoroughly mix medication before pouring. Discarded any medication that had changed color or turned cloudy. Remove cup and place upside down on countertop. Held butter so label was next to palm of hand and pour medication away from label. Place medication cup on flat surface at eye level and fill it to desired level. Wipe lid with paper towel before capping. If medication is less than 5 ml, prepare the medication in specifically designed oral syringe. Label the syringe with the name of medication and the route PO. For all medications, place prepared medication and MAR together on the medication cart. Recheck label on container before returning bottle, box, or envelope to its storage place. Avoid leaving prepared medication unattended. Lock medication cart before entering client's room. Check room number against MAR if agency does not allow MAR to be removed from medications cart. Provide for client's privacy. Next is prepare the client. Introduce yourself and verify client's identity. Assist the client to a sitting position. Took the required assessment measures. Explain the purpose of the medication. Administer the medication at the correct time. Took medication to client within the guidelines of the agency. Gave client sufficient water or preferred juice to swallow the medication. Stayed with client until all medications were swallowed. Dispose of all supplies appropriately. Arrange stock and return cart to its appropriate place. Discard used disposable supplies. Good morning, ma'am. Good day po, ma'am. My name is Janica J. Spiritu and I'm your student nurse. So for today po, ang gagawin po natin ay bibigay ko lang po yung medications niyo po na kailangan niyo po i-take within today po. So, but first po, I'm gonna close the door lang po para po sa privacy po.
Okay po.
So may I know po your full name po?
Jasmine Miyuki J. Spiritu po.
Okay. So for today po, yung mga i-take nyo pong mga medications ay yung your vitamin C po, which is the Lucilin po. And the next is your 2 tablets of Biogesic po for your cough po.
Okay po.
Okay. May I know po kung ano pong feeling niyo po today? Are you good po?
Opo.
Comfortable po ba kayo sa room niyo po?
Opo.
Okay. So first po, ayusin ko lang po yung position niyo po into your sitting position po para po mas maayos po yung pag-take niyo po ng medication niyo po. Okay lang po ba yun, ma'am?
Okay po.
Okay. Okay po, ma'am. Asok po kayo. Ayan. Ito po yung vitamin C niyo po. Okay. Ito naman po para po sa ubo niyo po. Ito po yung tubig niyo po. Okay po. May IC po. Okay. So for the next medication, which is the ophthalmic medication, first we're going to prepare the client, assist the client to her comfortable position. Next is to clean eyelids and eyelashes. The next thing we're going to do po is administering ophthalmic medication po for your eyes po. Is that okay po, ma'am?
Opo.
Okay. So first po, ayusin ko lang po yung position niyo po. Okay. Okay po. Apply clean gloves so that there will be no infections. Use sterile cotton balls moistened with sterile irrigating solution or sterile normal saline and wipe from inner canthus to outer canthus. Next is administer eye medication. Check ophthalmic preparation for name, strength, and number of drops if liquid was used. Instruct client to look up the ceiling. Give client a dry sterile absorbent sponge. Expose lower conjunctival sock by placing thumb or fingers of non-dominant hand on client's cheekbone just below the eye and gently drawing down the skin on the cheek. Hold medication in dominant hand and place hand on client's forehead to stabilize hand. Approach eye from side and instill correct number of drops onto outer third of lower conjunctival sac. Mrs. Spiritu, pwede po tumingin po kayo sa taas. Okay po. Or held tube about lower conjunctival sac and squeeze 2 cm of ointment from tube into lower conjunctival sac from inner canthus outward. Instruct client to close the eyelids but not to squeeze them shut. For liquid medication, press firmly or had client press firmly on the nasolacrimal duct at least 30 seconds. Remove and discard gloves and perform hand hygiene. So for the eye irrigation, place absorbent pads. So for the eye irrigation, place absorbent pads under head, neck, and shoulders. Place emesis basin next to eye to catch drainage. Or conjunctival sac. Filled and held eye irrigator about 2.5 cm above the eye. Irrigate the eye and directed solution onto lower conjunctival sac from inner canthus to outer canthus. Irrigated until solution leaving eye is clear or until all solution has been used. Instruct the client to close and move eye periodically. Clean and dry eyelids as needed. Wipe eyelids gently from the inner to the outer canthus to collect excess medication. Remove and discard used gloves. Dispose materials used and perform hand hygiene. Apply an eye pad as needed and secure it with paper eye tape. Assess client's response immediately after installation or irrigation and again after all the medication have been acted. And after that, you have to document the findings. So for the next medication is the Otic installation. So first you need to clean the pinna of the ear and the meatus of the ear canal of the patient. Apply gloves if infection was suspected. Use cotton tip applicators and solution to wipe pinna and auditory meatus. Administer the ear medication. Warm the container in hand or place in warm water for a short time. Partially filled eardropper with medication. Strengthen the auditory canal. Instilled correct number of drops alongside of ear canal. Press gently but firmly a few times on tragus of ear. Ask client to remain sideline position for about 5 minutes. Insert a small piece of cotton fluff loosely at meatus of auditory canal for 10 to 15 minutes. Dispose all materials used in an appropriate receptacle. Perform hand washing after the procedure. Chart the administration of the drug. Write down the name of the drug, time of administration, and the site of administration. And lastly, document the findings. Ganyan lang po kayo for about, ganyan lang po yung position niya for about 5 minutes po. Okay po?
Okay.